April is National Occupational Therapy Month, and during this month, we are stressing the need for occupational therapy, especially those that are transitioning from a facility to home. Today, I have with me Ryan Clark, an occupational therapist and also the owner of Smile Home Therapy. How are you doing, Ryan?
I'm good, thank you. Thanks so much for having me on today.
It's a pleasure to have you here. So I've got a couple questions for you today, Ryan, and the first question is, how can an occupational therapist help caregivers, whether they be family caregivers or professional caregivers, help their patients or their loved ones at home?
That's a good question. Occupational therapy really has a broad domain, and one of those pieces that I think kind of goes untouched is the ability to come into the home and work with the caregivers to assist the patient. We have all kinds of ways we can do that. The traditional way that most people are familiar with is establishing some type of home exercise program. And those are always customized to the patient themselves. So we can come in, establish the needs of the patient, develop a home exercise program, and so the patient can maintain their strength, improve their strength, maintain their balance to reduce risk of previous episodes, falls, things like that. That's kind of the traditional, what most people think of therapy-wise. But we also have a unique ability to come in and work with the caregiver and the patient as far as adaptive equipment that may be needed for the patient. Assistive devices that the patient could utilize, technology, assistive technology that could be beneficial for the patient and the caregiver. And what we would do is come in and assess the needs for these items, and there's too many to talk about, but they really do make a big difference in the lives of helping people live more independently and reducing the burden of the caregivers themselves. One of the big areas that we focus on is individualized training and education. So that means anything from teaching safe transfer techniques, proper body mechanics for the caregiver, strategies on behavioral management, because sometimes things can get a little out of hand there. Effective daily routines, just to get the patient in a good, effective daily routine. Sometimes can be difficult, and we can come in and help with that. Another way as well is to come in and work on or look at home safety. Is there any modifications that are needed in the home that could benefit the patient and make it a little easier on the caregiver? And not just the home, but also the vehicle as well. Sometimes getting in and out of a car is difficult. So really the opportunities are endless for us to provide some of that education and training to the caregivers.
So Ryan, from everything you said, I can see how occupational therapy can be very beneficial for many members of our community. Another question I have for you is, how do we pay for it? Is Medicare a pay source for occupational therapy?
Yeah, absolutely. Yeah, we come in, we do a complete free assessment in the beginning, and it is a covered service under Medicare. So that's something that, the patient would basically come out of no cost out of their pocket or very little cost, depending on the program that they're on.
Okay, sounds good. So Ryan, before we go, can you tell me a little bit more about Smile Home Therapy?
Absolutely, yeah. Smile Home Therapy, we are a home therapy company. We come into the home, work with the patients, work with the caregivers, and really just to improve the lives of these older adults and support the caregivers around them. And if you want to give us a call, it's 941-557-5073. If you just have a few questions, call me. You can check out our website, smilehometherapy.com, and we'd be more than willing to come talk to you or just take a look, see what's going on.
So Ryan, we want to thank you for coming, and for our audience, we want to thank you for watching this video. We hope that you found it very beneficial. Remember, April is National Occupational Therapy Month, and if you see an occupational therapist, please give them a hug. And until next time, take care.
Thank you.